biceps brachii, which the long head originates at the supraglenoid fossa, the short head at the coracoid process, and they both insert into the radial tuberosity. So the patient is going to be supine, and the first step is to get them into a position of comfort. So I'm going to palpate for the bicipital groove to feel the long and short head. Then you're going to flex the elbow, because that's the motion that the biceps brachii does, is shoulder and elbow flexion. So the position should be pain-free, and you want to maintain a light and gentle touch on the tender point that you palpated. So then you will bring the arm across the body to shorten the muscle and apply an axial load, and you will hold the position for 90 to 120 seconds, and the body will tell you when it has released, and that can be done through either the limb getting heavier, the muscle potentially twitching, or melting underneath you and getting very soft. Okay. All right, so we're going to be doing the positional release technique for the QL, which originates on the transverse process of L1 through L4 and inserts into posterior iliac crest. So you'll go to the opposite side of the table, and you're going to find the muscle and roll along, finding any hard points or points that really cause some pain, some tenderness. So once you have found that, you will go to the other side. We'll have the patient be prone, obviously, do a side bend to shorten the muscle, and then you're going to, while holding, extend, adduct the leg, and that will shorten the muscle, and you will feel the muscle release. And this could be melting, twitching, or just getting really heavy in your hand. And this one is a very quick release, but you should still hold it for at least 30 seconds to make sure, because you might miss it, and then you will slowly return them back to the starting position. So this is the positional release technique for the iliacus. So first, going to find the ASIS, and then roll in, see if there's any tender points, which there is. And so it originates at the iliac fossa and inserts into the lesser trochanter. So to do this positional release, you are going to bring them into flexion and external rotation, and to make sure that it is the iliacus, you are going to go into deeper flexion, and you are going to palpate at the iliacus, keep a light touch to feel if there's any muscle release, and you will hold this for 90 to 120 seconds, feeling for melting, fluttering, or the limb to get heavy in your hand. And once the muscle has released, you will slowly return it to the starting position, making sure that you are doing all the work. Okay, so we're going to be doing a mobilization with movement technique on the PIP joint of the index finger. So first, you're going to palpate the area, make sure nothing is broken, anything like that. So let's say your patient came in after jamming their finger playing basketball. So you would take them through different ranges of motion of flexion and adding, well, first have them flex, make sure they can. Good. So then you'll apply a force, a slight force on this side and then at the other side of the joint side, and have them flex and ask if that makes it better or worse. If it did not make it better, you can try applying force from the opposite side and have them flex. And let's say this makes it better, but it's not quite good enough, you can add a rotational component. So I would do a slight rotation there and then have them flex and move with them to make sure that it's rotating. And then once you found a position that was the best comfort level for them, you would have them do 3 sets of 10 repetitions. And the reason we do this is this will help increase blood flow to the area, open up the area, and start the healing process so that swelling doesn't get too crazy and that they can start playing. Okay, so we're doing a mobilization with movement technique for knee flexion. So the first thing you're going to do is get them onto the table into the 90-90 position and have them flex towards you to see how much movement they have. If the movement is restricted, you can do a mobilization technique of the tibia to help them get to more flexion. So the first thing you're going to do is palpate the the tibial tuberosity and place your hand underneath there. And then the next hand will be at the fibular head. And so then you will go into internal rotation of the tibia and have them flex forward. And you're going to maintain this internal rotation throughout the whole movement. And if that feels good for them, you will do 3 sets of 10 repetitions. Great. And then if they wanted to get even more movement, you can have them assist you. So again, make sure that they palpate below the tibial tuberosity, and then the next hand will be at the fibular head, internally rotating, and then you will place your hands more distally and go into internal rotation and have them flex. And again, do 3 sets of 10 repetitions, making sure that you're holding this internal rotation throughout the whole flexion movement. And this will help increase blood flow to the area, promote the healing process, and to increase their mobility of the